when we do a hip replacement, we make an incision on either the front or the side of the hip, go down into the joint and take out the ball, the top portion of the thigh bone, which is where most of the arthritis is. And then we place a metal stem into the top of the thigh bone, usually made out of a titanium material. And on top of that goes a ceramic head ball, and that reproduces the part that we took out on the thigh. And then in the pelvis, we'll clean up whatever arthritis and bone spurs and damage there is there, and put a metal shell, again made out of a titanium material, into that hole with a plastic liner that then fits over the top of the head ball. Most commonly used here is a more advanced, more modern type of approach where we go from the front side of the hip joint, what we call an anterior hip. And that involves a little less damage to the structures around the hip, the muscles and things that we can more move out of the way rather than having to detach or cut muscles or other tissues. The other main approach is what's called a posterior approach. It means coming from the back side of the hip joint. The incision is usually made on the side of the thigh, and that works very well also, but it does involve a little more taking down of some of the tissues around the hip. Generally, the choice of approach depends a lot on the specifics of the anatomy of the patient. That certainly can dictate one way or another. The type of arthritis or the degree of damage to take one versus the other. But what really matters on a hip replacement is not so much how you got into the hip, so much as what you do inside there. As long as the replacement is done well, it probably doesn't make a long-term difference as to the approach. But generally with an anterior approach, patients get up a little faster early on. So when deciding which patients to operate on is a fairly complex question. But generally what we want to see is somebody who obviously has severe end-stage arthritis, meaning a bone-on-bone sort of a joint. So it generally depends on the degree of pain and limitation on your daily activities. Things move much more quickly these days after hip replacement than they used to. Generally, most patients are up walking an hour or two after surgery. There's really no downtime at all. Most patients use a walker or a cane for about 2 to 4 weeks on average, although there's of course a lot of variability. Full recovery takes a number of months, but it's very front-loaded in the first few weeks. So the big question on a modern hip replacement is always how long is this going to last? And generally I tell patients I think 30 years is a reasonable ballpark. They really last quite a bit longer than they used to. The materials are much, much better than what we historically used. So I think the recovery and the work after a hip replacement is critical for your recovery. Every patient needs to do absolutely as much walking as they possibly can. Oftentimes this will be with the help of a physical therapy in their office or at home, but sometimes patients can even just do it on their own without having to go through formal therapy. But certainly the biggest factor in the success of a hip replacement is the amount of work that the patient does after the surgery and their recovery.